example here. So we can have all kinds of structural problems with the spine, disc, stenosis. And I treat in Florida, I treat geriatric patients. They're mostly older patients. And they have chronic pain. They come to me. They've been to many doctors. And the doctors will see the structural problems through the MRIs. They've got the disc, they've got the stenosis, and they come to me and say, I've got the disc, I've got the stenosis. And they may have seen 10 doctors before me, and the doctors may refer to surgery. And this applies not just for back pain, it applies for foot pain, wrist pain, any kind of muscle pain. They've come, doctors are telling me to do surgery. But with kinetic acupuncture, we can get really good results on that first treatment. Now, when making a prognosis, this is the highest level of knowledge that you can have. If you can make an accurate prognosis and deliver on it. So quite often in the clinic, these elderly patients come to me, they tell me their story, you've seen it, the doctors recommend surgery and so forth. And, I say, wait a second, none of these doctors have even said it might be just only a muscle tendon issue. They've looked at the structural problems, and they focus on the structural problems. But with every structural problem, there can be a structural problem, but there may not necessarily be any symptoms associated with it. And in regards to pain, the muscle tendon issue is the dominant pain, and actually the only pain. We can have of the spine stenosis, disc problems, but we don't have any symptoms of it. The spine is a very resilient structure, and so these structural problems, they exist in 30 to 70% of the population, but not nearly that high of a percentage of the population has any symptoms associated. So we have them, but there's no problem. No problem, don't worry. You feel okay, don't think about it, don't focus on it. But then when they come to pain, you can have the structural problem, but there's no symptoms, really. With experience, you'll learn that. The pain, the dominant pain is muscle tendon pain. So that's the favorable prognosis. I sit down in the examination, and I look at their history and I say, you know what, so-and-so, I think this is a very favorable situation we're dealing with here, and I think I can make you better today. And we do it with kinetic acupuncture. And their face brightens up. Really? Oh, that would be great, So we go through the kinetic procedures, we do the treatment, and lo and behold, they feel better. And what a surprise, what a relief after, the terrible going to the hospitals, going to the doctors. It's just very depressing. They have a depressing outlook on their future. And then you deliver them a great result. Well, both you and the patient are going to celebrate that moment of feeling well and encouraging them. This is favorable. If I get you a good result today and you're feeling good right now, that's very favorable. Now, yes, maybe the pain will come back, even if it comes back in an hour, but comes back in a day or 2 days, that's the real deal. This pain is just a muscle-related issue. Now, with kinetic, we teach stretching, and I'll go into that technique in a moment here. So, celebrate with confidence. With kinetic acupuncture, I can deliver great results for these patients in the first treatment. And what happens, a great referral source, they're very ecstatic and very good referral sources. So I'm going to explain kinetic acupuncture, and I'm going to just explain word for word with how I explain it to my patients when they come in. And so, a muscle tendon pathology. Okay, that's what we're dealing with this kind of pain. So, the analogy I like to use, and I begin by asking a question. I ask, have you ever gotten a massage? And when you get that massage, they say, hey, you've got knots in your muscles. Has that ever happened to you? It's sore. Okay, well, the analogy of a knot in a muscle is if you take a piece of rope and you tie a knot in it, it's going to shorten the length of that rope, okay? So, if I use my biceps, if my biceps has knots, these knots are tangled up muscle tissue and fiber. They bunch up and they tangle up in the muscle, and then they shorten the length of the muscle. and then begins 3 processes. The first process is that the tendon which attaches the muscle to the bone is more stretched. The muscle is short, the tendon is more stretched. This stretched tendon can start to rub against adjacent tissues, leading to localized pain, inflammation, and swelling. Well, this is a tendinitis diagnosis, okay? Furthermore, over the longer course of time, this stretched tendon can start pulling the joints out of alignment, which will lead to the eventual development of bone-on-bone arthritis. Now also, when somebody comes to me with a radiculopathy, they've got the sciatic symptoms, they've got some numbness going down the legs or pain going down, or the arms. Okay, now we have to differentiate that. Where is that coming from? Is it coming from a central nervous system, a bulging disc, some kind of central nervous system obstruction? Or is it coming from a peripheral nerve impingement? Well, if it's coming from that peripheral nerve impingement, that shortened muscle may be pinching on the nerve, or the stretched tendon may be pinching on the nerve, causing that same exact type of radiating pain. So the second process with muscle that's short with knots is we lose our range of motion. Right now I can fully extend my arm, but if this muscle, my biceps was short with knots, maybe I can only extend it this much. And if I have an accident and I go beyond, that's a muscle sprain, strain, or a tear of the muscle or tendon. The last thing is that, and this is straight from Dr. Choi, the muscle becomes dry and stringy, and he calls it like a beef jerky-like consistency. It's very dry and stringy. And that's when the nerve can get pinched in the peripheral neuropathy. It's when that muscle is very dry and stringy. Or if we're doing some motion with the shoulder, you can feel the tendons. There's that whole, if you feel the tendons snapping, it's just a general joint instability. Well, those muscles are just dry, stringy, the tendons are stretched. So instability of the joints. Now, we also caution our patients against cold. We don't like cold. We don't like ice. And there's still doctors telling the patients to put ice. And they recommend using ice because they say, you've got inflammation, that's pain, swelling, and heat. Put ice on that heat. But the problem is, in this kinetic theory, the inflammation is not the root cause. The root cause is the muscle that's short, that's adding tension on the tendons, which is generating the heat. Well, if you add ice to that muscle that's already short with knots, that ice is going to constrict the muscle even more. So we consider the use of ice will keep somebody in a pain for a longer period of time. And I get a few patients a week that have been recommended to use ice. And some of them are been using ice for years or very long time. And so I tell them, you've been putting yourself in pain for a long time because of the ice. And so instantaneously, no more ice. I'm done with it. I'm just going with heat and warmth. So that's a life-changing moment for these people. I mean, just the simple that ice on the muscle is not good in your case, And again, celebrate with confidence. Okay, so they've been using ice, and I'm like, okay, I'm getting more confident. And this is even before the treatment. Okay, you've been using ice. Okay, now I'm starting to get more confident. I'm going to deliver a good result for them today, So the idea with kinetic acupuncture is that we want to stretch the muscle. The theme of kinetic acupuncture is stretching. Now we can do that with the needle. We want to go in with the knots. There's a couple of techniques with the dry needle trigger point going on right now. When we do a neck, the neck is the one muscle that I would say you can predict that the muscle is going to jump or twitch. Have you ever had the muscle jumping or twitching? The trapezius is the one that, I'm 90% of the time, we're getting that muscle to jump and twitch. And it's a very good response, very favorable. There'll be sore afterwards, but when that muscle jumps and twitches, I equate it to, it's untying itself with the knots. It's relaxing the muscle, it's lengthening the muscle. So stretching is the theme there. So we can call it a form of kinetic, it's a trigger point therapy, the muscle stretching with the traps, okay? But the kinetic is also used, we use acupuncture with movement for the feet problem, the knee problem, wrist, hands, lower back. We start doing acupuncture with movement. So the technique now, if you look, I'm going to read through this here. So on this handout here, you'll see, I used LeBron James, the NBA superstar, because I was watching the finals in 2014, and it was the first game of the NBA finals, and the air conditioning went out in the arena, and it was just super hot. He's dehydrated. I mean, they're sweating just buckets of water, so of course he's going to be dehydrated. He needs to hydrate. But the trainers were putting ice. I mean, they saw it on television where he's got ice on his legs, his knees, his whole body is like ice right on the sideline. Well, what happens later in the game? He gets debilitating cramps, on the court, where literally they have to carry him off the court, and he can't play. And his whole game one in that final was ruined. And it didn't go much better for him, that series. So that's the first pages. But then you'll see in that first few pages, there's the pathology, the muscle pathology is in there somewhere that I just explained to you. Yeah, the mechanisms. I wrote about 7 mechanisms of trigger points of muscle shortening. But in what I explained to you, what I explained to the patients is 3 points. It's the muscle short, tendons tight, we lose our range of motion, and the muscle can become very dry and stringy. So we want to stretch. We don't like using cold. Now, with the kinetic techniques, kinetic acupuncture, you can flip the page and you'll see that we have a plantar fasciitis, demonstration of kinetic acupuncture for the treatment of plantar fasciitis. So in this case, plantar fasciitis is pain on the bottom of the foot, on the instep usually, but it can also be on the back of the heel, Achilles tendonitis. So with our approach with kinetic acupuncture, the root cause is the calf muscle, the gastrocnemius. In particular, we find the medial gastrocnemius. So the technique, when we do kinetic acupuncture, we'll have the patient standing in this position, like in the picture here, and we'll have them put their calf muscle in a stretch. Now, when that muscle is in a stretch, I'll run my fingers up, going up towards the head. So when you do a stretching massage technique, you work from the lower towards the head or chest. You rub in an upwards direction towards the head or chest to stretch. So we're putting the calf muscle in a stretch, and then I'm just checking. I just rub my hands and fingers up the leg, and lo and behold, it's very sensitive and tender to the patient. And they didn't even realize that they had any pain there. And sometimes just touching, it's oh my God, I'm getting dizzy. So you got to watch out on that because they're standing up. So they may get a little lightheaded. And that can be just from palpating as you check. But you'll find the trigger points a lot on the medial calf muscle. Well, those are the knots. And those are where we want to insert the needle to untie those knots. So in this position, I will do the acupuncture. I'll insert the needles, and then we do isometric resistance stretching with the needles in place. So I'll be down on the ground, and then I have 2 procedures with the plantar fasciitis. The first one is their foot is drawn back, and then I ask them to plantar flex. I'm asking them to elevate the heel while I'm pressing down with my hand. So they're going to lift the heel up off the ground while my hand is pressing down. It's pushing, it's resisting. This is an isometric stretch. The isometric resistance stretches, you put the muscle in a stretch, and then you have them initiate the agonist movement as you offer the resistance. So I'll use my hand because using the hand and this is exactly the same principle. If I had a wrist pain here, hand or finger pain, we'll treat the muscles of the forearm here, and I'll put the hand in a stretch, and in that position we can palpate for the trigger point, and then we'll do the acupuncture here. And then what I'll have the patient do is I'll have them flex the wrist, but I'm resisting that motion. So these muscles are contracting to flex the wrist, but since I'm resisting that motion, they're flexing, but the hand's not moving. So the only alternative is that the muscles stretch. This is an isometric stretch. So with the needles in place. So the idea is, again, is that by doing this, the muscles are going to stretch. We're untying those knots with the acupuncture, and then it's going to eventually stretch the muscle, and it's going to relax the tendons on the hand and the wrist. You see this a lot with trigger fingers. You just put it in a stretch, and the trigger finger is usually, these tendons are so tight they're pulling the finger down and they can't extend the finger that much. Well, you just stretch with the acupuncture. And most of the time, these patients don't stretch. They never stretch, So with that, the plantar fasciitis, this can be a 5-minute treatment, and you've delivered a great result to them in 5 minutes. This is a celebrate with confidence treatment for sure, because a lot of them have been recommended for surgery, which is terrible, foot surgery, who wants that? And they go to the podiatrist, and, surprise, surprise, the podiatrist doesn't even acknowledge any kind of muscle tendon issue. It's straight to the pharmaceuticals or straight to the surgery. So these people are depressed, and they've been given the worst case prognosis. And then we do the treatment, and within 5 minutes, I'll tell them straight up, I think we'll get your result in about 5 minutes here, And so that was part one of that stretch. Now, I had a variation to this calf muscle stretch. Does anybody have foot pain, plantar fasciitis? Not much. If you ever do, the variation is just a common calf muscle stretch. And so I'll explain this as I explain my patient. The idea is you want to bring your foot back as far as you can, but the heel has to touch the ground, okay? So you bring your foot back as far as you're able. Now, you want to push, this is the variation idea, is that you push against the wall. And as you push against the wall, you let the force pass through the body, and it's going to drive the heel in the ground even more. And it's going to provide a greater degree of stretch. Now, I'll be down on the ground, and sometimes I'll be lifting their toes as they're doing that. So then I'm even providing even further stretch by lifting the toes. So this is a stretch that I send my patients home with. I teach my patients to stretch. I'm not happy to treat a patient all the time chronically. I don't want to see a pain patient for more than 3 treatments, honestly. Then I start to feel like I'm failing them. And maybe it's something beyond my skill, but I want to get those results definitely within 3 treatments. And so I send them home to do that stretch. And in Florida, there's hot tubs and jacuzzis and warm water. I say that warm water is the best place to stretch because it softens the muscles, it improves the blood circulation. So if they can do that stretch in the hot tub or jacuzzi, it's really fantastic. So very simple, sometimes, they come to you with 3 or 4 complaints. I've got back pain, I got neck pain, I got the plantar fasciitis. And you're like, okay, well, I'll do your back and neck, and I'll show you the foot stretch. And sometimes the foot stretch alone without acupuncture is life-changing. So it's all based on kinetic acupuncture, the muscle pathology, with acupuncture. And I think it's a very innovative therapy. I certainly don't want to denigrate acupuncture itself. This is acupuncture. I think all acupuncture is very effective, but with the kinetic, it's something I rely on, and it makes me happy because I can get results fairly well. I can make a good prognosis. And then, so foot pain, plantar fasciitis, wrist pain, knee pain, it's all the same, basically. We do knee exercises, knee movement exercises with resistance. So, for instance, with knee, Dr. Choi taught me this, is that the patella, it has a track, and it goes up and down. But if the quadriceps are unevenly balanced, if the lateral or the medial is short with the knots, then it can cause the patella to go off track. So we're focusing on the quads here to balance the knee here for knee pain. So we have a couple of techniques. I'll have the patient lie on the table. As they're lying down, their knee is slightly flexed. I'll do the acupuncture on the knotted areas on the quads. And then we do a shaking. He calls it, what did he call it? Shaking and
oscillation.
Oscillation, yeah. So first we'll do an oscillation exercise, loosen up the joint cavity. And then we go into the resistance, where I'll have, in various degrees of flexion, I'll have the patient do that, and then they'll push up their foot against my resistance as they're lying on the table. And then I'll after the treatment, I'll have them stand up, and we'll see how far we can go. I'll be sitting in a chair, and I'll bring their foot back as far as they can go. Maybe they're not able to do that. They can maybe only go that much, but however far they're able to go and however comfortable they are. And then I'll have them kick their foot down against me. So what's happening here is as I flex my knee, I'm stretching the quadriceps here. And then when I have them push down, the quadriceps are firing to move the leg, but I'm not letting it move. So the only option is that they're stretching. So this is another thing. I send my patients home and say, do that stretch. If you got a hot tub, that's wonderful. Do it in the hot tub, And they get better at just stretching on their own. So many times, they've been coming in with the worst complaint, the worst system in the medical, and they leave and they come back maybe 1-2 times, and they're like, I feel great. I don't have to come back. You're fantastic. Well, this is all thanks to Dr. Choi. He really, made me a professional. To gain the confidence and respect of your patients, making your prognosis and delivering accurately on that prognosis will just raise your esteem in the patient's eyes. So I think that's going to conclude the kinetic part of the lecture. Does anybody have any questions on that? Sure.
In case of the kinetic acupuncture and for the musculoskeletal pain like that, have you ever got really more case or more results in case with the paralysis?
Paralysis. Sometimes, that can be a question of whether it's a peripheral neuropathy or if it's central nervous system. Now, in my experience, I actually haven't treated many full paralysis patients, and I haven't worked on them. So we did a little bit when we were in the clinic, and we did deliver good results on a paralysis patient, but in my own personal experience, I haven't treated a full-on paralysis. However, the peripheral neuropathy patients, I've had really good results where they do come in with the numbness or the radiating pain, like down the arm. And also, say somebody comes in with the radiating pain down the arm and the numbness, and it's a red flag. I consider it a red flag. That's something serious. Is it coming from the neck? They're not. Are they dropping objects? Well, that's a red flag. You definitely have to refer out. If there's some kind of nerve impingement going on. But this is also interesting with kinetic acupuncture. To deliver those good results, sometimes you got to work at it, and it's a lot of work because, okay, somebody comes in with this radiating pain on their arm, and they have a neck complaint. So you're like, okay, could be coming from the neck, a pinched nerve in the neck, but it also could be possibly coming. Maybe there's two things going on: just the localized neck pain, but also a peripheral nerve impingement. So when they have that, okay, I'm going to start with a kinetic procedure on the wrist. And so if I can deliver a result where, hey, it was numb, now I'm getting feeling back, and I just worked on the wrist only, okay, well right there, it's peripheral. It's a diagnostic procedure. Okay, all of a sudden, okay, great. Now it's probably not a central nervous system impairment. It's just, if you can get a good result just after doing the wrist exercise, kinetic wrist, then it's probably just peripheral nerve impingement, at least that part of the complaint. And then the neck, you do the trigger point acupuncture on the neck, and you can get good results. So paralysis, full-on paralysis, no, and I just haven't seen any patients, and that would require a long treatment plan. So I haven't seen any long treatment plans like that. But still, sometimes you get the presentation of a paralysis kind of, and it's like a peripheral nerve impingement. So Did that help at all?
Yeah.
Yeah, it's definitely like a diagnostic tool.
Yeah.
Like, it's great. I mean, it's one of my favorite things, like celebrate with confidence. They come in with a numbness down the arm. They've been diagnosed with some kind of terrible neck thing. Here you go, you do this simple exercise. Hey, I have feeling again, especially with plantar fasciitis, because they get like the swelling for years, just loss of feeling on the feet for years, and they've been through the process. And then you do the technique, and like, oh my God, I can feel the floor, you know? So again, celebrate with confidence, like you get it like almost instantaneously. So yeah, that peripheral nerve impingement can be turned into something very favorable very quickly. Yeah. What was your question?
Yeah, I have a few questions first.
Mm-hmm.
Do you only use kinetic acupuncture for pain management?
Mostly. Now, you know, I'm gonna need, can you get me some water? Thanks. I'll answer your question.
Yeah.
So,